This is a Class 2 amalgam procedure for tooth number 19, mesial occlusal distal, or MOD, amalgam. First step is to turn on the light over the chest and angle it up to the area of the mouth you will be working on. First, we will place topical, drying the site with a 2x2. Getting topical on our cotton tip applicator, closing the topical immediately, and then placing the topical at the injection site for 1 to 2 minutes. After 1 to 2 minutes has gone by, remove the cotton tip applicator. We will then pass the anesthetic syringe to the dentist, following all safety precautions. As the dentist recaps, we will then perform a full mouth rinse on our patient. After anesthesia has taken place, we will then place isolation. After isolation is placed, we will pass our mirror and explorer to the dentist. During a procedure, you always need to have the next instrument ready at hand. In this case, it will be the high-speed handpiece. While using the high-speed handpiece, the assistant should always suction. Next will be the slow-speed handpiece, being sure not to tangle the cords between that transition. Next will be our spoon excavator. While using the spoon excavator, the assistant should do short bursts of air to keep the field clear. After the dentist has completed using the spoon excavator, the assistant will do a limited area rinse. After the limited area rinse, you will retrieve the spoon excavator and pass the Toffelmeyer retainer. The dentist will place it on the tooth, and then you will need to pass the cotton pliers and a wedge. The wedge will be placed on the lingual side for each contact. Retrieve the cotton pliers. Then you will begin to mix your amalgam. While the amalgam mixes, you will need to take your Copolite, open, using your cotton pliers, get a cotton pellet, dip in the Copolite, immediately close the Copolite. Pass the cotton pliers with the Copolite covered pellet. While the dentist applies the base, you will then take your amalgam capsule, empty it into your well, and take your amalgam carrier and load. Retrieve and pass. You will then need to alternate between a condenser and the amalgam carrier until the cavity prep is completely filled with amalgam. The dentist will signal you when that is complete. Okay, after it is complete, make sure your amalgam carrier is completely free of amalgam. Then you will alternate between the different sizes of condensers at the dentist's request. She can state small or large, or she might just keep wanting whatever you're giving her.
Small.
After she has completed condensing, we will then pass the burnisher. While the dentist is burnishing, we will need to suction. During burnishing, excess amalgam is pushed away from the tooth. After burnishing, we will pass our carver. Again, keeping our suction steady to catch all excess amalgam. After the dentist has completed carving, we will then remove the top of my retainer and wedge. We will need to pass our cotton pliers for the dentist to retrieve the wedge, and then the dentist will pass us the tophomer as it's removed. Then you will need to remove your isolation in order to check the bite. Sometimes the dentist will check, but in this case, we would like the assistant to do the checking. The assistant will then instruct the patient to close, lightly tap their teeth, and grind side to side. The dentist will then make sure that the bite is where it needs to be, and if it is, we will then take a wet cotton roll and remove any excess blue marks from our bite paper, and also to shine up our amalgam restoration. Just for patient comfort, we would then do one last full mouth rinse to remove any excess materials from the mouth. After the procedure is over, we would then instruct the patient on post-op instructions. For instance, Mr. Jones, your mouth is numb. Be careful not to bite your lip, tongue, or cheek. Do not eat until your mouth awakens. The filling is still not as hard as it can get, so please chew carefully. If you have any questions or concerns, please let us know. Then you will document in your chart the date, tooth number, tooth surfaces, and the type of materials you used, as well as anesthetic, post-op instructions, and your initials. This completes the Class 2 amalgam procedure.